Welcome to your personalized deep dive from All Sorts podcast.
Oh, cool.
Yeah, we are diving into something that you might even have, like, right in your medicine cabinet.
Oh, really?
Yeah, it's chlorphenamine.
Interesting.
So you, the learner, have given us some stuff from the NHS to, like, Wikipedia and even Medscape.
Okay.
We're going to break down the important stuff about chlorphenamine, make it clear and engaging just for you.
That's good.
Yeah. So, you know what it is, how it works, all that without getting, bogged down.
Right.
So,
Yeah, let's unpack this.
okay. So first off, looking at your sources, it's kind of wild how many things chlorphenamine is used for.
Yeah, it's pretty impressive. Like just the sheer range of conditions, allergies and things like that.
Oh.
So you've got your hay fever. The NHS guidelines mention that itchy eyes, everyone hates those.
Yeah.
Eczema flare-ups, hives from food allergies, even chicken pox.
Wow.
Itching from chicken pox insect bites, stings. It's
Like,
pretty versatile.
Yeah, for sure. And the NHS also mentions it comes in like tablets and liquid.
Okay, you can get it prescribed, but it's also over the counter.
That's pretty common for allergy meds.
Yeah, and here's where it gets like really interesting.
Okay, I'm intrigued.
Sometimes it's in like cough and cold medicines.
Oh, wow.
Yeah, like under different names. So if you are grabbing something for a cold, like check the label.
Yeah, that's good advice.
Yeah, you might be taking chlorphenamine without even realizing it.
Right?
That actually reminds me of something else the NHS said.
What's that?
So they advise against giving cough and cold meds that have chlorphenamine to kids under 6.
Oh, yeah, that makes sense.
Unless a doctor says it's okay.
Yeah, I can see why they'd say that.
It's so important to know what's in those over-the-counter things, especially for little ones.
Absolutely.
All right, let's get into like how it actually works.
Okay. The science behind it.
Right, so the NHS explains that chlorphenamine is an antihistamine.
Makes sense.
So when you run into an allergen,
Yeah.
your body releases histamine.
Right. And that's what causes all the problems.
All those annoying allergy symptoms. The sneezing, itching the watery eyes. It's a whole thing.
Yeah, so chlorphenamine is like the blocker. It blocks the effects of histamine.
So like a shield almost.
Yeah, so you get less of the itchy eyes, runny nose, all that.
That's how it brings relief.
Mm-hmm. Now, Wikipedia goes a bit deeper and talks about how it blocks the histamine H1 receptor
Right.
and that it's a potent inverse agonist.
Oh, yeah. That's an important detail.
What do you think about that?
Well, that term inverse agonist, that's key. Because it means that chlorphenamine isn't just blocking the histamine.
Right.
It's actually like turning down the receptor's activity, even without the histamine there.
Oh, interesting.
Yeah, and that might be why it works so well,
Uh-huh.
for those symptoms.
Okay.
Now, Wikipedia also mentions that it can act as a serotonin reuptake inhibitor too.
Really?
Yeah, but it's not as strong for norepinephrine and dopamine.
Ah.
So that might be related to some of the side effects we see.
Okay, speaking of side effects, we got to talk about those.
Yeah, that's important information for sure.
So the NHS is very clear about labeling chlorphenamine as a drowsy or sedating antihistamine.
Yeah, so it makes you sleepier than some other options.
Right. Some common side effects they list are like feeling sick, feeling sleepy or dizzy,
Right.
having a hard time concentrating, dry mouth, headaches, and blurry vision.
Yeah, those are pretty typical for this kind of medication.
And both Wikipedia and Medscape agree with those, and they add a few more.
Oh, like what?
Things like confusion, constipation, anxiety, restlessness,
Oh, wow.
decreased coordination, shallow breathing, hallucinations, irritability.
That's quite a list.
Yeah, memory problems, tinnitus, trouble peeing.
So it's not just a simple allergy pill.
Definitely not.
It can really affect the body in a lot of different ways.
Exactly. So remember, it's great for allergies because it blocks histamine, but that drowsiness is a real thing.
Yeah, you got to be mindful of that.
For sure. Now, speaking of drowsiness, Medscape says that's the most common side effect people report.
That's not surprising.
They also say that dizziness, sedation, and low blood pressure can be worse in older adults.
That makes sense.
And that actually matches what the NHS says about frail older people being more likely to experience side effects like confusion.
Right. So age and overall health are super important to think about
Okay.
if you're considering chlorphenamine.
Totally. And there are some specific warnings about who shouldn't take it at all.
Like what?
So the NHS says talk to your doctor or pharmacist if you have glaucoma,
Okay.
problems peeing epilepsy,
Mm-hmm.
or if you are going to have an allergy test.
Interesting.
And also if you have problems with alcohol because some of the liquids have a little bit in them.
Oh, wow. I didn't know that.
And of course, they repeat that kids under 6 should only have it if a doctor prescribes it.
Right.
Medscape adds a few more things to that list.
Okay, what else?
So, like, if you're known to be hypersensitive to chlorphenamine,
Of course.
lower respiratory conditions like asthma,
Yeah, that makes sense.
premature babies and newborns, and women who are breastfeeding.
So those are all situations where it's best to avoid it.
Exactly. Why do you think those are so important?
Well, a lot of it has to do with how chlorphenamine interacts with what's already going on in your body.
Okay.
Like, for example, it has these anticholinergic properties, and those can make things worse if you have glaucoma or problems peeing.
Oh, I see.
And then the whole drowsiness thing, that's obviously a big concern with breathing problems or for tiny babies.
Makes sense.
And as for nursing mothers, both the NHS and Medscape mention that it can pass into breast milk.
Oh, really?
Yeah, and that can make the baby drowsy or irritable.
Oh, wow.
So it's all about understanding the potential risks and avoiding them where possible.
Right. Okay. Let's talk about dosage.
Okay, that's a big one.
So the NHS gives some guidelines.
All right, what do they say?
For adults and kids over 12, they say don't take more than 6 tablets in 24 hours.
Okay, and what about the tablets? How much is in each one?
Oh, yeah, 4 milligrams each.
Okay, good to know.
And they really emphasize that the doses for kids under 12 are lower and less frequent.
Yeah, they should definitely talk to a doctor for those.
Absolutely. And frail, older adults also need a lower max dose.
That makes sense. Their bodies might process it differently.
Mm-hmm. Medscape actually gives us even more detail about dosage.
Oh, really?
Yeah, they talk about extended release formulations and specific amounts for allergic rhinitis at different ages.
Wow, that's pretty comprehensive.
What stands out to you about all these different dosages?
Well, I think it's clear that chlorphenamine isn't one size fits all.
Right.
You know, the extended release options might be more convenient, but that total daily limit is still super important.
Mm-hmm.
And the fact that there are lower doses for kids and older adults, it just shows how crucial it is to tailor the medication to the person.
Yeah, and their potential for side effects.
Exactly. And Medscape has this interesting point about potentially avoiding it in the elderly altogether.
Really, why?
It's because of those anticholinergic effects. Again, they mentioned the Beers criteria, which is something healthcare professionals use to make decisions about medication in older patients.
Oh, interesting.
So that's definitely something doctors need to keep in mind.
Okay, let's move on to interactions with other things.
Yeah, that's a huge area with any medication, really.
Right, so the NHS says you should check with your doctor or pharmacist if you're taking MAO inhibitors,
Okay.
phenytoin, or anything else that causes drowsiness, dry mouth, or trouble peeing.
Makes sense because chlorphenamine can make those worse.
Exactly, and Medscape has this massive list of drug interactions.
Wow, really?
Yeah, they even categorize them like contraindicated, serious, significant, and minor.
So they really cover all the bases.
They do, and there are warnings about increased sedation if you take it with opioids or other sedating medications.
Right.
And also how other drugs that affect these CYP3A4 enzymes can change how chlorphenamine is broken down by the body.
So even over-the-counter meds can get pretty complicated when you factor in all these interactions.
Absolutely. It just shows how careful you need to be.
For sure,
Oh.
especially if you're already taking other things or have some health conditions.
Now, you mentioned Medscape's long list of interactions.
Yeah, what about it?
It's not just prescriptions. It even includes some herbal stuff like kava and ashwagandha.
Oh, wow. So people really need to tell their doctor or pharmacist everything they're taking.
Absolutely, even if it seems like it's not a big deal.
Right, because it could interact with chlorphenamine.
Exactly, and those CYP3A4 interactions you mentioned.
Yeah, those are interesting.
They can either increase the chlorphenamine levels in your system,
Which could mean more side effects.
right, or they could decrease its effectiveness.
So it's like a double-edged sword.
Yeah, so the learner, what does all this mean for you?
Well, it means that chlorphenamine is a really useful antihistamine.
Yeah, it's widely available.
Right, and can really help with those allergy symptoms by blocking histamine. But there's a big but. We have to remember that it can make you drowsy,
Yeah.
and it has the potential for side effects and interactions with other things.
So always stick to the dosage instructions.
Definitely.
Be careful about mixing it with other meds, even over-the-counter stuff and supplements. And if you have any health conditions or you're just not sure,
Talk to your doctor or pharmacist.
absolutely, it's always better to be safe than sorry.
I agree.
So
Yeah.
hopefully this deep dive into the world of chlorphenamine has been, valuable and clear.
Yeah, I think we covered a lot of important ground.
We did, and it's fascinating how even a common medication can have such a complex profile.
Yeah, it really makes you think about how we approach those everyday over-the-counter meds.
Definitely understanding how they work, the potential side effects and those interactions, it all helps us make better decisions about our health.
Absolutely. Knowledge is power.
Now, for those of you who are like, wow, I want to learn more, keep that curiosity flowing.
Yeah, keep digging.
Go check out those resources we talked about, or bring us your sources on another topic that you're just dying to know more about.
We love to explore.
All right, before we wrap up this deep dive, let's talk about All Sorts Podcasts.
Yeah.
If you enjoyed this exploration of chlorphenamine and you know you want more like this, consider joining our journey.
Yeah, become part of the community.
It's easy. Just share and subscribe to All Sorts Podcasts on YouTube.
It really helps us out.
It does, and it helps these insights reach even more curious minds out there.
Like spreading seeds of knowledge.
Exactly, and we've got a whole library of past deep dives on all sorts of topics.
So many fascinating explorations.
We invite you to check out our other podcasts we've already made. You might just find your next aha moment.
That's the best feeling.
And you can also connect with the All Sorts Podcast community by following us on X, Instagram, and Threads.
Yeah, we're everywhere.
We love hearing your thoughts and continuing the conversation beyond just this audio experience.
It's all about connecting and learning together.
Okay, and finally, a little something to ponder.
All right, hit me with it.
So we talked about how chlorphenamine is an antihistamine, but it also has that weaker effect on serotonin reuptake.
Right.
What other medications that we think of as simple might have these hidden layers of effects?
Yeah, that's a great question to think about.
What deserves a closer look?
Keep those minds curious.
Until our next deep dive, keep exploring.